Hello, and welcome to this episode of Ask Dr. Ken. Once again, I'm Dr. Ken Guda, your consultant gynecologist and your IVF specialist. The question we're considering today is whether or not obesity affects the outcome of IVF. It may interest you to know that there is a global epidemic of obesity, and a campaign is going on worldwide, more especially in the European society or in the United States of America, advising or instructing people on how to cut down on obesity. Obesity has a bearing in a lot of health issues. But how does it affect your fertility? How does it affect especially IVF? Obesity is usually when your body mass index is equal to greater than 30 kilograms per meter square. These days we see a lot of people assessing the IVF treatment cycle with body mass index that is greater than what I've just described. This is usually what we refer to as obesity. Don't wonder when your doctor asks about your height and your weight, because it's important to know what your body mass index is before commencement of an IVF treatment cycle. Obesity encourages some degrees of hormonal imbalance. Hormonal imbalance has effect on the number and the quality of eggs that is produced in the course of an IVF treatment cycle. Obesity also affects the quantity or the dosage of medication that is being used in the course of IVF treatment cycle. Studies have shown that larger doses or higher doses of medications are used in the obese as compared to the doses used within the same age group when in the non-obese category. Obesity affects the response to IVF medications. Studies have also shown that the rate of response or the response to IVF medication is lower within the obese age group. The rate of generation or development of follicles and oocyte is lower within the obese age group as compared to their counterparts on the non-obese categories. An important observation is the quality of eggs that is gotten in the obese group. Increasing number of studies have shown that there is increased numbers of mitotic spindles that is seen in the oocytes of the obese. This is an indication of chromosomal abnormalities or genetic abnormalities that is seen in the oocytes of the obese as compared to the oocyte of people within the normal body mass index. And if you have an abnormality in the oocytes, in the DNA or the chromosome of the oocytes, of course, it goes a long way to affect the outcome of the IVF treatment cycle, because the rate of fertilization, rate of implantation, rate of clinical pregnancy, it's going to be lower in the obese age group as compared to the cohorts of the non-obese. The prospect of carrying pregnancy to a logical conclusion or to term is lower in the obese age group, because you may have a lot of or some metabolic problem associated with pregnancy in the obese age group. Things like diabetes in pregnancy or gestational diabetes, as it's commonly called, or hypertension in pregnancy or other metabolic diseases. The rate of miscarriages is higher in the obese than non-obese. The rate of embryo aneuploidy is higher in the obese than non-obese of the same age group. And the chance of having IVF cycle cancellation or no fertilization or no transfer at all is also higher in the obese age group as against the cohort of the non-obese arm. So there's nothing I think that is desirable about the obese infertility because fertility treatment costs a lot. In some European countries, you are advised to cut down on your weight, otherwise your sponsorship or insurance will be restricted until you are trimmed down to the normal weight before IVF treatment cycle is commenced. I don't think it should be different in this part of the world, because obesity affects IVF outcome negatively. For more information about obesity and IVF, or even fertility, you can contact us at our hospitals in Rayfield, Jos, Nigeria. Or better still, visit our website at www.abshospitals.com, or you contact us through any of our social media handles. You may equally subscribe to this YouTube channel. Until I come your way next time, I'm Dr. Ken, your IVF specialist and minimal access surgeon. Thank you.